Dr. Fort, the NICUDoc, and I thought I'd just come here live and talk to you a little bit about some of the things we need to watch out for when we have a baby at home, and what are the reasons to be able to think about possibly going to the emergency room. So, first of all, congratulations. You have your baby at home, everything's going really great. But let me tell you that it's, especially within the first year of life, there are about 15 to 20 different infections happening during that first year. Now, calm down. Yes, that seems like a lot, and of course it is, but that doesn't mean that these are serious infections. In fact, the most common thing that, that babies get or that infants get are colds, regular colds. So, you have to keep that in mind when I talk about infections. But what's really important is that if I'm telling you you have 20 infections a year, especially during that first year, well, how do you decide whether you want to just, keep your baby at home or whether you have to go to the emergency room? That's always the difficult part. As a parent myself, it's always really tricky to decide, whether you should go home or not, whether you should go to the emergency room or not, or keep your baby at home. So let's talk about some of those signs that you can see in your baby at home that will tell you that you should go to the emergency room, or at least talk to your doctor. All right, let's get to the first thing. So with colds and coughs and sneezes and viruses, you're going to have a lot of those symptoms. You're going to have runny nose, you're going to have coughing, you're going to be very congested. And that's one of the scariest things as parents, is that you feel that your baby, it's all congested. You can hear your baby all congested. And so you have to, decide, is this bad? Is this an okay kind of virus? One of the things that we look for is signs of respiratory distress. What is that? So respiratory distress is essentially increased work of breathing. What you can see is what we call subcostal retractions. So underneath the rib cage, you can actually see that there is some kind of dipping in of the chest. Okay, those are called retractions. Sometimes you can see it at the areas of the ribs as well. Your baby's breathing hard. Those, again, are called intercostal retractions. Sometimes you can even see some elevation of the shoulders, or the actual nose is flaring, it's kind of opening and closing. Those are all signs that there is something going on in the lungs that's affecting your baby enough that it has to use extra energy, extra muscles to be able to take and get oxygen in and be able to oxygenate the body. So all those signs that a baby's working hard definitely is a reason to at least call your doctor or go to the emergency room. Another thing, number 2, is fever. So what is fever in an infant? So fever is 38 degrees or Celsius or 100.5 Fahrenheit. If your baby has that or above, that may be a reason to go to the emergency room. Now, especially during the first 30 days of life, this is something really important, because there are some infections that can get to places where you cannot see, and that is in the fluid around the brain or the spinal cord. And when there is an infection there, it can cause irritation, inflammation, and the infection itself. And that's something called meningitis, because there's this tissue around the brain that is called the meninges. So itis is inflammation or infection, and so meningitis. And for babies, this can be extremely dangerous, because it can affect them long term. So if you have a baby less than a month of age without any signs of distress or anything like that, but still has a fever, then it's definitely a call to your doctor, and you may need to go to the emergency room as well. Number 3, dehydration. So babies, of course, are supposed to be able to eat well. They're supposed to, take, and when I say eat, I'm sorry, I mean, either formula or breast milk or some type of milk, some type of intake during the first, few months. Of course, then later, they might be taking some solid foods. Now, they need to get hydrated. They get hydrated from milk. They get some of that hydration as well from the food. Because the kidney is still very young, especially during the first 6 months, they have to be constantly getting fluids. It is very easy for a baby during the first few months to get dehydrated, to not get enough fluids. And when this happens, what you can see is that the sodium, one of the chemicals in the body, one of the electrolytes, can elevate very quickly. And if it rises very quickly, it can even cause seizures. So you want to make sure that your baby's getting enough fluids, even if we're not eating as much. Especially, again, once you get to the eating stage, if you're not eating as much, you at least want to make sure that they're getting enough hydration. And that is obviously trying to get them to be feeding their formula or breast milk, every 3 hours to be able to maintain hydration. After that, after the 6 months, you can use free water. We don't recommend using free water before the 6 months because of the immaturity of the kidneys. The kidneys are not able to concentrate very well. So actually giving water before 6 months of age can cause them to get even more dehydrated. And it can actually drop that sodium too quickly. And that, unfortunately, can also cause seizures. So you want to make sure that they're staying well hydrated. How do we know if there's signs of dehydration? Well, when they're crying, you are not getting any tears. On the inside of the mouth, it looks dry. And also, if they're not making any wet diapers within 12 hours. So if you're looking at diapers and they're not getting any pee, then that is a concern for possible dehydration. So you want to make sure there's nothing going on there. The other sign would be lethargy or poor activity. Normally we know that babies sleep a lot. Most of the day they're going to be spending their time, 2/3 of the day or more, they're spending their time sleeping. However, the babies do wake up to feed. If you're finding that your baby is having trouble getting up, it's too sleepy, it's normal for them to have a little lag time, right? As you're waking them up, but they'll cry and they'll immediately want to eat. If you notice that they're getting very sleepy and they're not getting up to feed when they should be, and you're waking them up and they're still not very active, that is a sign that that baby may need to go to the emergency room, or at least so that you can have a conversation, with your pediatrician. Another thing, obviously, and I mentioned this already, but another thing is seizures. Seizures in general can be extremely scary. Now, there are some movements that the babies do that are not necessarily seizures, and this is actually why it's very difficult to determine whether a baby really is having a seizure. But any concern of possible abnormal movements, especially when you see these movements that are having a rhythm that is very particular, that is constant, and especially if it's lasting more than 3 minutes, then this is a reason to go. Now, sometimes babies can actually get, within the first 6 months to 6 years, they get something called a febrile seizure, which is where if a baby is having a fever, especially high fever, they can actually have a seizure with it. And it's the scariest thing in the world. But of course, you take a deep breath, you be calm, and as long as they're not having any oxygen changes, and I'll talk about that in a second, then you do want to take them to the emergency room for evaluation, or at least talk to your doctor. Now, I mentioned already the changes in oxygen. So how do you see that clinically? You see this as cyanosis, or changes in discoloration of the inner parts of the tongue, or the inner part of the inside of the mouth, or in the chest area. You can actually see the skin turning a bluish discoloration. This, again, is a concern that the oxygen in the body is dropping. And therefore, again, that is definitely an emergency. That is definitely a reason to go to the emergency room. So if you see any of these signs, that would be a reason to go. Okay, so unless you guys have any comments, if you do have any questions or comments about some of these things, please add them in the comments below. If you want to see more of these videos, please let me know. I'm always happy to come on and talk to you about any questions you guys have. As always, if you like this video, please, hit like. If you haven't subscribed to my channel, I do a lot of, information about babies in general, or babies that have to end up in the NICU, in the neonatal intensive care unit. I am Dr. Ford. I am a neonatologist, a baby specialist. Happy to serve you with any questions you have. I cannot talk directly about individual cases, but always happy to help out in any way I can. Thank you so much, and we'll see you with the next video.